Hi, my name is Linda Bermani, and I'm going to be talking to you about the diversity audit of SSM Health. I would like to give you a little information first beforehand. The management at SSM Health was not very forthcoming or transparent about their current situation with diversity and inclusion. So a lot of this information you are getting from me as an employee of SSM Health, and I hope you will be interested in the information. The business summary for SSM Health is they're a Catholic organization. They're a not-for-profit healthcare system serving the Midwest. They have a great organizational team and providers that are committed to providing exceptional healthcare and services, revealing God's healing presence to everyone they serve. We have facilities in Illinois, Missouri, Oklahoma, and Wisconsin. We have 23 hospitals, more than 290 physician offices and other outpatient and virtual care services, 12 post-acute facilities. We also have comprehensive home care, hospice services, a pharmacy benefit company, a health insurance company, and an accountable care organization. Some facts about SSM Health at a glance you can see here. I will just touch on a few of them. As you can see, virtual visits. We've had nearly 24,000 monthly visits since the pandemic that started in 2020. And we also give back to our community close to $400 million, and that's done through our Samaritan Free Clinic and also providing other free healthcare services to individuals and going to local events and things, giving back to the community. The mission statement of SSM Health is that through our exceptional healthcare services, we reveal the healing presence of God. They have a vision of peace, hope, and health for every person, family, and community, especially the most in need. They have 5 health values. These were inspired by the founding religious sisters. They had valued the sacredness and dignity of each person, and thus came up with these 5 values, because it's consistent with their heritage and ministry: compassion, respect, excellence, stewardship, and community. SSM believes that every person is made in the image and likeness of God, and as such is sacred and deserving of reverence, dignity, respect, and compassion. In the footsteps of the founding sisters, they live by the principles of social justice and focus their work on the poor, vulnerable, and marginalized. SSM Health has quality principles which include patients and other customers are their first priority. Quality is achieved through people. All work is part of a process. Decision-making is made by facts. This was most evident during the pandemic and continues to be so to this day, with us receiving as employees the most current updates regarding the pandemic situation and how it's affecting our healthcare services and how we provide that to our patients. And quality requires continuous quality improvement. There are some web links that I have here, part of this PowerPoint presentation, that if you'd like to pause and click on them to learn more, you are more than welcome to do so. We have information about accountable care organizations, and that's that SSM Health participates in a Medicare program. Community health, that we work in collaboration with our community partners to develop programs that help create healthier communities. We also have diversity inclusion, which is a new, it's been around, but it's actually becoming more prominent in the forefront, and being actually more transparent within the workplace, that we are working on improving this area within the organization, especially including or inclusivity is an integral part of how we operate, and we do that all the way from our patients to suppliers, and you can click on that link if you'd like. Some other ones are financial information, government affairs, our qualities and outcomes, and SSM Health at Work. SSM celebrates diverse cultural and family traditions. They believe creating a culture of inclusion is a journey, and which starts with having an understanding of the people and who they are, having us learn about the different cultures of our patients and fellow co-workers. SSM Health has a diverse workforce that represents many world religions, faith communities, and cultural traditions. This is mainly seen within our physician base here in this rural hospital where I work at. The diverse workforce is probably more visual and apparent at our larger sites, such as in the Madison area, St. Louis, Missouri area, and even in the larger cities in the Illinois area. We like to recognize and understand the significant observance and diverse special days in the workplace, because that helps enhance awareness and mutual understanding of the various ways everyone celebrates cultural and religious traditions. And by doing that, SSM Health Diversity, Equity, Inclusion Calendar shares the rich traditions and significant observances of the diverse faiths and religions. So on this calendar, as an employee, I can go look at that and see what special days are coming up for the different cultures. This can actually help when trying to plan meetings, or for the home care providers when they're going to provide care for a patient. And actually we can use it to plan workplace festivities and other community events. Our education and diversity and culture is important to SSM Health. Employees each year complete a competency related to culture and diversity. And basically it's because SSM Health wants every employee to be able to answer the question, what is cultural competency and why does it matter in healthcare? And basically, to sum that up for you and how I would answer that is that having cultural competency means that it's going to improve the healthcare experiences and outcomes of the patients, clients, suppliers, and everybody that we work with within the organization. The slide that you're seeing here is a employee-only website link, and under each of the 4 categories, each bullet point actually has a link that the employees can click on to learn more information about diversity and inclusion. And it's one way that SSM Health is working on educating their employees. We do have a DEI, that's Diversity, Equity, and Inclusion Committee. The organization has this devoted committee to focus on diversity, equity, and inclusion for all employees and clients. They have several subgroups to focus on different areas, such as the patient experience, employee inclusion, community support and involvement, and many more areas. I have the opportunity that I'm able to sit on this committee to help improve our diversity and inclusion within our organization and for our patients and our employees as well. And that has become a very strong, what word am I looking for? Compassion-driven goal of work that I possibly want to complete in the near future, to work with other organizations to actually help improve the diversity and inclusion within their organizations. My overall grade for SSM Health would be a B minus. And I guess I'm giving them this grade based on all the information I was able to find on my own. The organization management, again, was not very willing to share much with me regarding the management's support to the employees. I was able to see an organization that was focused and concerned with making sure that all employees, patients, suppliers, and visitors felt welcomed, valued, respected, and included, regardless of their race, religion, gender, and how they identified themselves. I wish, and I'd like to see them improve to be more open and willing to share information and be more transparent regarding their diversity and inclusion. I had gotten the feeling that they did not want negative feedback regarding their possible shortcomings on their part of diversity and inclusion, which had saddened me because I felt it would have been a great opportunity for them to actually learn from myself on things that they could possibly change or improve, but they did not really want to speak or hear anything from me, and I did not want to force myself on them to make or to give suggestions. And that is my reference. It is a website regarding SSM Health. I'm hoping that you were able to get some information, and hopefully you can go back through, look at some of the slides, and see if there's anything else that interests you about SSM Health. And thank you for your time.